Hello friends, today we're going to study about the skull. So skull is made up of short and long bones which are connected by the suture joints. For example, this is our skull and this is the mandibular part. So this skull this is our skull and it is made up of the sutures. So the sutures is look like this. So these are the refracted or lines which are present in that, and these are joined the bones in the skull. So these are known as sutures. So skull is called the skeleton of head because it provides the basic structure and basis to this head, skeleton to the head. So it is known as the skeleton of head. Only mandible is the movable bone in the skull, as we have the four part of the skull is divided into four part: cranial, facial, mandible and hyoid. So only mandible is the movable part. This is the mandible part which contain the lower jaw or upper jaw. So it is only movable part in the head of the animal. Now we comes to the cranial bones. The cranial bones form the cranial cavity in the eye orbit. For example, this is the eye orbit that it's formed the cranial cavity here. And the cranium is collectively bones known as the cranial cavity. Type of cranial bones are 11, which are, for example, occipital, sphenoid, ethmoid, parietal, frontal, temporal or interparietal. So these are the bones. Occipital is 1 in number, where the sphenoid is also 1 in number. Occipital attached to the atlas, which is the first bone of the cervical vertebra. The second one was sphenoid, which is 1 in number. Ethmoid is also 1 in number. Parietal is also 2 in number. Frontal is 2 in number, in which the horn is present and the corneal process is present. This process is known as the corneal process, and this is the frontal bone in the animal. So here the frontal bone is present. This is the horn, and this is corneal process from which the horn arises. During the as you study about the horn amputation, this nerve is get blocked, corneal process for this. So this nerve get blocked. Next one was the temporal. Temporal are 2 number attached to mandible. This is the rigid bone. And last one was interparietal, which is also 2 in number. Now comes to the facial bones. Provide primary organ for the respiratory and digestive system. So facial bones are the bones which provides actually the basis or the skeleton to the respiratory and digestive system. These are also 9 in number. The maxilla is 2. The paramaxilla are 2 in number. Palatal is 2 in number. Pterygoid is 2 in number, nasal is 2 in number, lateral is 2 in number, molar is 2 in number. Only vomer is the bone which is only a single bone present. And last one was tuberate, which is also 2 plus 2. So the all comes out to the 19 bones are present, and the maxilla is the largest bone. And the maxilla and premaxilla both combine and form the upper jaw of the animal. Now comes to the next part. The occipital bone have two occipital condyle, in between them a hole of a cavity found, which is known as the foramen of magnum, and which the spinous process is passed out. So this is the occipital bone, and from which there is a foramen or is a hollow process in which the spinous or spinal process in which the spinal cord is passed out. And now comes to the next part. Body largest cavity or hole is obturator foramen, which is formed by the ischium and pubis. Ischium and pubis are the form bones of the pelvic girdle, and these form the largest cavity. Let me make it out clear. Body's largest cavity or hole is obturator foramen. Okay, and the ischium plus pubis, these may combinedly form hip bone. Skull largest hole is foramen of magnum. So when we called in the term of the skull, it is comes to the foramen of magnum. But when called in the terms of body, the largest cavity or hole is obturator foramen, which is formed by the ischium plus pubis and forms the hip bone. Now come to the jaw. Jaw is formed by the two types: lower jaw and upper jaw. Lower jaw, for example, this is our skull and this is jaw. So this is divided into the upper jaw and this is lower jaw. So this is divided into two parts. The lower jaw contains mandible, whereas the upper jaw contains maxilla plus premaxilla. Maxilla is divided into premolar plus molar, which is formed cheek teeth, and premaxilla have incisor and canines, which is formed our buccal cavity. In horse, the canine teeth is present, but in mare, the canine teeth is absent. There is a ritual in the weddings and etc. that they are using the mare instead of horse, because mares don't have canine teeth, so there is a possibility to bite the groom is very less, so they are using the mare instead of horse. Incomplete eye orbit plus incomplete mandibular symphysis are present in dog. Pig have snout or osrostral visceral bone. Frontal bone was corneal process present in which they have horn. There is a process like this corneal process in which the horn is present, and now the fowl only one occipital condyle is present, and fowl only one occipital condyle is present. Premaxilla plus nasal bone forms the beak, or in birds and fowls. For example, this is beak. So this beak is formed by the premaxilla plus nasal bone, and teeth, lips, cheeks, soft palate are absent in the fowl. Upper jaw is also movable, and mouth is cone shaped. As we know, their mouth is like this, so this is considered as the cone shaped, and the tongue is triangular in the shape. So these are some points about the fowl. You have to learn it out. Another third part was mandible. Mandible is divided into two parts: body, body plus ramus. And the ramus was divided into two parts: vertical ramus plus horizontal ramus. This is vertical ramus, this is horizontal ramus. So now we gonna study about the diagram. This is the diagram of our mandible. So this part is known as here. There the incisors are present, which are useful for the stretching or for the cutout of things. This part is called diastema. This part is used for the molar and premolar. Here the teeth are present. Here the coronoid process is present. This process is known as coronoid process. This is articular facet. This is articular condyle, and this is the verticular ramus. This is verticular ramus, and this is the horizontal ramus. So as I said you already, the ramus is divided into two parts. This is horizontal ramus, and this is verticular ramus. There is a foramen which is known as mandibular foramen, and here another foramen is present which is known as the metal foramen. Now we have completed this. Now let's come to the next part. Yes. So there is a note that in the mandible below vertical ramus, angular process is present, and in mandible is attached to the temporal bone of skull on upper side. On upper side it is attached to the temporal bone. Fourth one point was about the hyoid bone. This is like how hyoid bone looks like. This is the structure of hyoid bone. Attached to the mandible and provide present at the base of tongue. Hyoid bone actually provides the basis to their tongue so that it can move. There is a one lingual process is present plus four cornea is present. Process in which it is bended is look like a horn. And the skull sinus ear sac cavity, which is covered by the plasma or membrane. Plasma membrane is bones called sinus. Actually, sinus skull sinus, there is a air sac like cavity which is covered by the plasma membrane in the bones, is called sinus. This is known as the sinus, air filled up space. This is the air filled up space, so it is known as the sinus. Now we study about the vertebral column, structure of typical vertebra. This is divided into three parts: body, arc and process. The arc is divided into lamellae or pedicle, whereas the process is divided into spinous process, division in the thoracic vertebra. As we know in that the spinous process looks like this, and these are present in thoracic vertebra. These are the spinous process, and these are subarranged in that. It is the second part of vertebral column. Articular process is present, and third one was transverse process is present, which is developed in the lumbar vertebra. Now it's how the typical vertebral column looks like. In the mid part there is a neural cavity in which the neurons and the neural systems is present, and the nerves are passes through by this. This is the spinous process, and it is articular process, and this is known as the lamellae. These are the pedicles which are present here. These are the pedicles, and This is the transverse process, and from here the neural rings are passing out. The articular process developed in the thoracic vertebra, and this transverse process is developed in the lumbar vertebra. So now this vertebral column part is completed. We now we studied in the detail in the detailing about the vertebra. First was vertebral column is formed by the 5 different type of vertebra. These are the vertebrae present. First one was cervical, second one was thoracic, third one was lumbar, fourth one was sacral, and fifth was coccygeal. Cervical vertebra, these are 7 in number, present at the neck region. First is cervical vertebra. Let me make it out one diagram. This is our skull. This is mandibular region. Here these are present. These are 5 in number. 7 in number. So these are present near the neck. The first one is known as the atlas. Here the second one is known as the axis. So these are the bones which are present after the skull. Let me clear this. Yes. So 2, 6, 7 form a typical, and 3, 4, 5 is form a typical. 1, 2, 6, 7 form a atypical, where the 3, 4, 5 is form a typical. Below cervical vertebra, foramen transversum is present. Let me make this. As I said you, these are the 7 bones. These are the 7 bones in which these are the which form an atypical structure: first, second, sixth, and seventh. So starting 2 bones and last of the 2 bones are form the atypical type of cervical vertebra, whereas the 3 are the form typical vertebra. Actually, these 3 are form typical vertebra because they form the they are very much developed, and these are show the how a cervical vertebra looks like. These are from the structure and basis to the cervical vertebra. Now comes to the first part, which is atlas. First cervical vertebra is known as atlas. Body and spinous is absent because it is almost round in the shape. Ring-like structure is present. Ulnar formation is present, and fovea dentis present. And fovea dentis, and note there is the fovea capitis is present in the femur. Let me make it clear out that there are 2 words, fovea dentis and fovea capitis. So fovea dentis is present in the ulnar foramen, in the atlas, in the cervical vertebra, but the fovea capitis is present in the femur. Thoracic vertebra, second one was thoracic vertebra. This thoracic vertebra was present 13 in number. These are 13 in number, present in thoracic cavity and connected by the ribs. So uh, this is the diagram I have already made it. So these are the cervical vertebrae present. This is known as the wither of the animal, and there the third and fourth cervical vertebrae are showing it. In this, spinous process is well developed by the foramen in the wither. Spinous process is well developed in this wither. Wither is the upper part, or which is the proximal part, which is comes out look like this in a wave shape. On the uppermost part is known as the wither, and it form the spinous process. Third and fourth thoracic vertebra, spinous process is well developed, which form the peak of the wither. So third and fourth thoracic vertebra form the peak of the wither. Third one was lumbar vertebra. Lumbar vertebra are 6 in number. These are present above the abdominal cavity, and the transverse process is well developed. And let me make it clear, these thoracic vertebrae are present, and these connect to the ribs, and this ribs is lower side connect to the sternum. So this part is completed. Now we go to the next part, which is sacral. So sacral vertebra, these are 5 in number but form a single bone called sacrum. These are actually, as I said you already, these are actually synchronized and these are fused together. So we can't differentiate in them in their individuality. So these are present above the pelvic girdle, or hip bone. As I said you earlier, for example, this is this. So it is present here. So sorry, this is the our pelvic girdle. So it is present, the sacral vertebra is present near this location. So Spinous process form the medial sacral crest, and the articular process form lateral sacral crest. There are two crests are formed. The medial crest is formed by the spinous process, and the lateral sacral crest is formed by the articular process. Note that the lateral surface of the sacrum is attached to the ilium. The lateral surface of the sacrum is attached to the ilium. Ilium is the bone of pelvic girdle. As we know, pelvic girdle is formed by ilium, ischium, and pubis. So from that, the ilium is word is come out, and this form the lateral surface of sacrum. Uh, Fifth one was the coccygeal vertebra. These are 5 and 20, 15 to 20 in number, 20 sorry 15 to 25 in number. Not well developed, therefore these are called the incomplete vertebra. And the formula of the cervical column we can see here. This is very much important formula. This is come in many time of exams and PYQs. That what is the formula of vertebral column? So you have to not to learn it out all these formulas. You have to just mark it out about the some specific formula, like for example cattle, horse, and fowl, and these 2 3 formulas are very important. So you can, if you learn. So first one is about the cattle. Cattle has 7 cervical, 13 thoracic, 6 lumbar, 5 sacrum, and coccygeal is to 15 to 25 in number. Now we come to the next part. In dog, the same formula is present, but the only the lumbar is converted. Lumbar is present one more, and the sacrum is deprived by the 2 bones, and the coccygeal is 20 in number. In horse, the 7 cervicals are present, whereas the thoracic is present in 18 in number, where the lumbar are 6, sacral are 5, and this is present the coccygeal. In pig, the 7 cervicals are present, thoracic is 14 to 15 in number, lumbar is 6 to 7 in number, sacrum is number 4 in number, and coccygeal is 20 to 23 in number. In fowl, the the cervical is present 14 in number, thoracic is 7, lumbar plus sacral are fused and formed 14 in number, and the coccygeal are 4 to 9 in number. In camel, these are present in 7, thoracics are 12, lumbar are 7, sacrum are 5, and coccygeal is 5. So there is a note that in the first lumbar plus sacral vertebra are found fused together and form 14 in number, known as synsacrum. So this is the synsacrum. This is synsacrum present in the fowl. The all the first lumbar and the sacrum vertebra are fused together and form 14 in number, which is known as synsacrum. In fowl, last 3 vertebra form pyramidal structure, which is known as the pygostyle. So you have to learn it out that it is known as pygostyle. Now we come to the next part, which is ribs. Ribs are of 3 types: sternal ribs, asternal ribs, and floating ribs. Sternal ribs are known as the true ribs. Asternal ribs are attached by the cartilage to the sternum, and these are also known as false ribs. And last one was floating ribs. So this is our vertebra, thoracic vertebra, and from here the 7 ribs are present. 1, 2, 3, 4, 5, 6, 7. These ribs are attached to the sternum. So these are known as the true ribs, where in the last part there are the alternate ribs are present, which is attached by the cartilage. So these are present attached by the cartilage. These are not directly attached to that, and these are the ribs which is attached by the cartilage. And the last one was floating ribs. These ribs are not attached to the sternum. These are in the floating way. So these are known as the floating ribs. Sternal ribs attached to the sternum. These are known as true ribs. These are attached to the sternum. Therefore, these are known as the sternal ribs. Or sternal, because they are not attached to the sternal and attached by cartilage. So it is called false ribs. And third one was floating ribs. There is no attachment to the sternum. Note there was a floating kidney left in the ruminant. Let me make it out clear that the floating rib and floating is a common word. Therefore, I had written here. So the floating have no attachment, is known as attachment to the sternum. So these are known as floating ribs, and the floating kidney are present in the left in the humans. Floating ribs are last one in the human and dog. As we know how the human and dog is very much similar in the anatomy. So the floating ribs and last one are present same as in the human and dogs. Yes. So this is the formula of the sternal, asternal and total ribs present. These are present in the pair. So let me make it out a diagram. For example, this is our thoracic vertebra. These are ribs, and beneath that they are attached to the sternum. Let imagine it's a sternum. So these are attached to the sternum. So these are known as the true ribs. These are attached to not attached. To, last one are not attached to the sternum. These are known as sternal ribs, and these are attached by the cartilage. And these last ones are for floating ribs. These are not neither connected by the sternum. So these are present in the pair, this and this. So we can consider both as a pair. Now the sternal ribs are present in the cattle 8 in number, in horses these are 8 in number, in dogs these are 9 in number, bears and pigs have 7 in number and fowl 5 in number. Sternal ribs are present in the 5 in number in cattle, 10 in the horse, 4 in the dog, 7 to 8 in the pig and 2 in the fowl. Whereas the total, when we calculate the total, their numbers comes that the 13 ribs are present in cattle, whereas in horse 18 ribs are present, in dog there are 13 ribs, in pig there are 14 to 15 ribs, and in fowl it is 7 in number. So in the horse these ribs are present, the 2, 3, 4, 5, 6. The middle ribs unicate and process, and these form as the unicate process. These are and the 2 and 6 behind the ribs a process is formed which is known as the unicate process. Note in cattle that the 8, 9, 10 ribs are largest and longest. The last ribs are no very longest and largest in nature. So now we're going to study about the sternum. Sternum is known as the breastbone, and it is the bone formed by the bone plus cartilage, and it is known as the osteocartilage structure. Each unit of the sternum is called sternabra, and there are the 7 sternums are present. These are the manubra, these are the sternabra, which is the unit of sternum, and this is xiphoid cavity. So the sternabra are 7 in cattle, in horse they are 7 in number, in dog they are 8 in number, in pig they are 6 in number, and fowl they are 4 in number. The structure is flat in all the animals. There is exception that in the horse these sternum is a boat shape like sternum is present. So here this I already making the diagram. This is looks like the boat shape. So therefore, due to this boat shape, the horses can't gonna step. As you listen or hear it out that the horse is not able to sleep because of their sternum, because sternum is like boat like in the shape. So when he gonna slip, her body get imbalanced by the sternum. So the horses can't get it slip in the sitting position only due to the mechanism. This is the lock mechanism. This is the boat, and these are the spaces by which when the sternum is gonna slip, this is the lower surface of the earth. So the body of the horses get unbalanced, and this is known as the lock mechanism. Now we study that. Here I am making a diagram of the fowl. This is the metasternum, this is keel or crest, and there are the 3 present which is known as the rostrum, and the bone is present which is known as furcula. This is very important point that the bone is present is furcula, which is bone attached to the rostrum, and this bone is attached to the rostrum. So learn it out very clearly that the furcula bone is present which is attached to the rostrum. And first one was clavicle. Clavicle is a bone which is also called collarbone. Dog and fowl have present where it is underdeveloped in the pig, and in cattle and horse it is absent. Note both sides of clavicle are attached to the lower side and form a V shape which is called a furcula, and next attached to the rostrum which is the part of sternum. Second one was the coracoid bone and only present in the fowl. It is anteriorly attached to the scapula by the posterior to the sternum. So here we go. These points are completed. In next lecture, we're gonna study about the bones of forelimbs and hind limbs. Thank you. Bye.